welcome to our Monday Minute. Today we're going to discuss some very important home health claim processing updates, clarifications that CMS issued via a change request 13-543 issued in early April of 2024. There were several things that were clarified in this change request transmittal that updated the claims processing manual. The first of those items is the county code. It has been a long time process or regulation that the FIPS code, which represents the county in which you have treated the patient, be included on the claim. Evidently, there have been systems that are not reporting the FIPS code on the claim, and CMS has now mandated that an edit be put in place so that that FIPS code be reflected on the claim. The next item is the notice of admission. The notice of admission, which is of course required to be filed within 5 days and accepted at the Medicare MAC 5 days from the start of care date. That NOA has issues occasionally that will cause it to go into return to provider status or T status. There has been clarification now issued in this change request and updates in the manual that show in order for you to be successful in requesting an exception to a late NOA that went into T status with its original submission being in the timely filing window, you will have to have made the correction within 2 business days. If the change that needs to be made is required to be made by canceling the NOA, you would need to cancel that NOA within 2 business days, and within 2 business days of it processing, issue the new one. It is imperative that you understand you cannot make changes to an NOA at any point in time that you decide a change needs to be made and think you're going to get a successful exception request. So do make sure that you are following those NOAs as closely as possible, and preferably ensure that the content of those NOAs is accurate from the point that you send it the first time. The next item is diagnosis coding, and this is huge. Diagnosis codes do not run in a calendar year as far as updates are concerned. Any updates to the actual ICD-10 codes go into effect October 1st of each year. There are occasionally some tweaks in April, but the big changes go into effect October 1st of each year. In prior years, we have had nightmares, to be honest, fighting the claim denials where the diagnosis code, when the OASIS was completed and the plan of cares were completed, were prior to the effective date of the new code, so you had to use the old code. And then when the claim was processed for payment, the claim went to T status for an invalid diagnosis code. And those had to be changed, and the whole nightmare had to be followed through. This update states that if the from date on the claim is prior to the effective date of the new code, that the old codes will be accepted and transmitted, processed on your claim based on the from date. So the example given is if the start date of your 30-day period is September 15th, the codes change in October 1st. When you file that first 30-day claim, the from date on the claim will be September 15th, and therefore that 30-day claim will process with the old codes. This is a huge, huge, huge situation, and we are hoping that it's real, meaning we're hoping that it's not just a manual situation, but that the claims processing systems actually get corrected and updated so that we definitely will see this go into effect by October 1st. We want to thank you all for listening today. If Healthcare Provider Solutions can help in any way with any claims processing needs, please make sure to reach out to us. I hope you have a fabulous week.